Welcome to Startup Health Now, the weekly show celebrating the healthcare transformers and change makers who are reimagining healthcare. My name is Stephen Krein.
And I'm Unity Stokes.
And on today's episode, we're going to talk to an entrepreneur and a policy expert about the opportunities for entrepreneurs to focus on underserved communities. This is going to be a great episode.
Stick around.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Welcome back to Startup Health Now, the weekly show celebrating the healthcare transformers and change makers that are reimagining healthcare. We've got a special episode today that's focusing on entrepreneurs' opportunities in underserved communities. This is part of a program that we're doing from a grant provided by Robert Wood Johnson Foundation, trying to highlight all of the opportunities that entrepreneurs have in bringing their innovations to the underserved communities, and also hopefully helping stakeholders in underserved communities understand the entrepreneurial opportunities by engaging with innovators. On today's episode, we've got Stan Berkow, who is the CEO of Sense Health, and Rachel Davis, who is a policy expert from the Center for Healthcare Strategies.
It's great to have you guys here. Thanks for coming.
Thanks for having us.
Let's start with, what is Sense Health and what do you do?
Yeah, so at Sense Health, so we're working with healthcare organizations who are basically at risk for the health of their patient populations, whether it's an ACO, a patient-centered medical home, groups that are at risk for those patients, and are starting to employ newer healthcare providers like care managers, social workers, health navigators to really work across large patient populations to support them with their health. And what we do at Sense Health really is kind of help them in two capacities. One, there's a big resource crunch for those healthcare providers with limited funds to only hire so many care managers and health providers to work with those patients. And so with Sense Health, we really try and increase the capacity so they can work across larger and larger patient populations as it's becoming increasingly important to manage them. And then secondly, the difficulty is really inherent in helping patients manage their health better and prevent future chronic issues and manage immediate chronic conditions. Our technology is really designed to kind of drive the behaviors that are necessary to get people to start living healthier lives.
That's interesting. And how did you guys first get connected? What does CHCS do, and how did you guys first connect?
Sure. So CHCS is a policy resource center. We're specifically focused on publicly financed healthcare, so the Medicaid, Medicare space. We do work with a variety of stakeholders. We do a lot of work with states and their Medicaid departments, healthcare plans that work specifically with publicly financed populations, providers, and also community groups that work with this population. So we also work with sort of across the gamut of this population. So from children to adults with complex complex conditions to dual eligibles, so folks who are elderly and have Medicaid and Medicare. And I am a mentor, actually, on Startup Health. I connected with you guys and was really pleased to be able to join your guys' mentorship program. And Stan, I think you just found me online and reached out and asked if you could give me a demo. And I was really pleased to hear from you. And it was great to get more information about your product.
So the reason we asked you both to be here today, obviously an entrepreneur who's building a business that really has a focus for its early customer base, maybe even its long-term customer base, on bringing your solution to underserved communities. And Rachel, because you become an expert over the last several years, and your organization's an expert nationally around helping stakeholders understand the innovation and the technologies that they can take advantage of to help their communities. So I think there's an interesting conversation that I want to make sure that we have today. I think the goal of today's episode is to make sure that we inspire entrepreneurs to think about and maybe even focus on bringing their solutions to underserved communities. And I want to open up the eyes of stakeholders in underserved communities to really realize there's lots of Stan Berkows. Oh, only one Stan Berkow. But,
only one Stan Berkow.
There's people like Stan Berkow out there that have really innovative solutions that can be brought to the community. So that's the goal of the episode. And I want to come back to Unity's first question to you and understanding a little bit more about what you do. What specifically are you doing in underserved communities? Give me an example of how you're working with a hospital or an organization in an underserved community and helping them.
Yeah, so the dynamic that we're really tapping into is a lot of high needs patients in underserved communities or outside of them are assigned healthcare providers to work with them, support them, help manage their needs, coordinate their care.
Right. Actually, we want to make sure we define for them an underserved community. Who are we talking about here?
I mean, so generally speaking, if you're looking at who's paying for them, we're working within the Medicaid population. In terms of the provider systems that are supporting them, it really kind of varies. It could be federally qualified health centers. There's kind of the emergence of health homes being implemented, which are similar to patient-centered medical homes in kind of their approach to patient care, but are specific to Medicaid recipients. You can work with certain hospital systems that might be more so situated in underserved areas and thus have a larger percentage of a Medicaid population. So I think the actual provider systems kind of varies across the board, but oftentimes I think we're always touching on more community-based health systems and those types of provider systems.
Okay, so let's go back. So how are you helping? So let's go back to how you're helping them now.
Yeah, so I mean, ultimately those systems are really tasked with something incredibly difficult, which is they have a ton of patients that are high needs and may not have the best understanding of how to manage a whole suite of chronic conditions.
Give me an example of one that you
I mean, so the two biggies in this space that we've been dealing with recently are mental health concerns and substance abuse issues. So those would be two areas that are very prevalent in this population, but those in conjunction with kind of the usual suspects on chronic conditions with diabetes, hypertension, those types of conditions.
Okay.
And so with those patients, they're often assigned care managers who are working with 50 to 100 to 150 of these patients at a time and responsible for supporting them, helping ensure that person understands what they're doing and going where they need to go. And what we're finding right now is there's a greater emphasis on supporting these patients with their conditions, that the caseloads for that health provider, that care manager entity, are growing. And it's creating unrealistic expectations to actually efficiently or really effectively support these patients when you're working with 150 people at a time. And so that to us was like a really great opportunity for technology to kind of step in and say, the work that these providers were doing when they were working with 30 patients at a time was incredibly effective. They were able to work with them, support them, and get these patients to manage their health. Now suddenly when you're doubling that, it's unrealistic. And the healthcare organizations in this space don't have the money to just double their staffing of care managers. And so it's really kind of coming into how do you develop technologies that can augment or increase the capacity of that provider. And that's where we think it is a great opportunity really in the space.
And so what are you doing specifically to help them double their workload or handle the doubling of their workload?
So ultimately where
he just wants to give them more work?
Yeah, I double their, no. I mean, ultimately where we're finding they're spending a ton of time is they're more reactive than proactive, right? So when you have so many patients, you can only respond to the needs as they're coming in as opposed to trying to get ahead of it. And where our company's background kind of comes into play is really on kind of behavior change and how do you develop interventions to get people to start changing their behaviors and managing their health on their own. And so what our technology does is helps them proactively set up a support plan that automatically gets delivered from that provider to their patient. And it's tailored and individualized with the goal of really helping that patient start to learn how to self-manage what they're doing better, while the provider is there and able to respond to the needs that are always going to require that human support and that actual provider entity.
So are you a mix of both human, you're a mix of both human and kind of technology together?
Absolutely.
It's not just technology.
Right, and one of the biggest things that when we started in this space, and independent of underserved communities, but I think it's a particularly important part to that, we find a lot of the kind of digital health tools that are touching patients and working with them and helping them really need to be connected back to a provider. Otherwise, people just aren't going to follow them. I think there's kind of, and this gets at like a an interesting area to talk about in this space, but with the Fitbits and the app craze and all of that, there's this kind of idea that you can build something really cool and that people are just inherently motivated to use their Fitbit and want to track their steps. But you go to the populations where people really need these types of tools, and no one cares about how many steps they're taking. They're not motivated to really kind of look at that and do that. And so where we find there's the greatest strength and ability to reach someone is getting them to feel that they're cared for. And with these providers already in place doing that, if we can strengthen that connection, that's what we think is really important with technology.
Can you guys, I think that's a very important point, and really this is a question for both of you, but what are some of the special needs and circumstances? I know you guys operate in, I think, all 50 states in terms of where there's vulnerable populations. What are some of these special needs that are really out there?
Yeah, so I guess first of all, just throw out a statistic, and it's something that we refer to a lot at CHCS. It's the 555 rule, as we call it. So what we see in the Medicaid space is that 5% of Medicaid beneficiaries account for 55% of the costs to the program as a whole. And what that really shows us or tells us is that there's this really small percentage of low-income folks, Medicaid beneficiaries, who really are struggling to manage their health conditions and are showing up all the time in the healthcare system because they can't get a grasp on their healthcare conditions. And Stan alluded, I think, to a number of the challenges that these guys experience when he talked about mental health issues and substance use issues. We definitely see those compounding, how complex it is to deal with chronic conditions. But I think more and more we're hearing the term social determinants of care thrown around, and it's sort of self-explanatory, but the idea behind that is all of these folks are operating in a social context that is very different than I think the sort of typical digital health consumer that we think of right now.
Does technology still play a role? Do people have cell phones?
Absolutely, yeah. So I've seen a little bit of research out there from Pew that just has, shows really high ownership rates of cell phones. I think it's somewhere along the lines of 53% of low-income populations own a smartphone. 43% own a basic feature phone. So, one of the things that Stan and I have talked about is just assuming that those ownership rates of smartphones are going to increase over time as the technology gets cheaper and more pervasive. I saw some really interesting research from a former colleague of mine, Maria Raven, out of the University of California, San Francisco, where they gave basic cell phones to, I think, 50 of their most expensive patients. And then they went through the phone records and tracked how are they using their phones, where they're just calling their relatives, were they, just having phone calls and conversations with friends. And what they really found is that these folks are using even basic feature phones to coordinate their care. A lot of the calls were for appointment management, setting up, appointments to get their benefits put in place. So I think folks in this population have access to maybe not the most sophisticated cell phone technology out there, but they do have access to it, and they are already using it as a tool.
So from the entrepreneur's perspective then, given these circumstances, how do you go about building your product? How do you go about commercializing with some of these circumstances?
Yeah, well, I think to your point about people are already using these technologies to work on their health, I think the best way of building a product is tapping into something that's already happening. And so it's something that we also saw with the care management groups that we've been working with, that their patients are already texting that health provider. They're already communicating through text right now to kind of help feel supported by them. And so being able to build a product around an interaction that's already occurring was really kind of a nice approach to take, as opposed to jumping in and saying, you might be working this way, but we now need you to work in this capacity through this new app or something, which isn't an interaction that's happening. So I think really tapping into what already exists and using that as kind of a jumping off point to then innovate on how that interaction's occurring is really important.
So you're not changing behavior, you're not changing tools.
Absolutely. I think tapping into behaviors that are already occurring, to then tweak behavior is critical. If you come in and you just behavior change 101, right? Like take smaller steps than bigger steps. So if you come in and say, I'm going to need you to start doing some different things and start doing it in a different way, all of a sudden it's too much.
Or with a different tool.
Exactly. And so being able to tap into what's happening, I think, is really important. I think just to kind of step back for a moment, I feel a bit like a fake here. We actually didn't build our product initially. We help support people through text messages. We didn't start doing that based on wanting to directly work with the underserved at the outset.
It doesn't make you a fake.
I know.
It makes you an entrepreneur.
Right. But I think it's interesting because what we were looking at, which then led us to working with underserved communities, was we were looking at, on the behavior change side, texting being very effective. And we were also looking at a lot of research that was happening. We talked about this in third world countries where people have very limited access, and texting, a lot of studies have been done around that. And so then that made it natural to kind of gravitate here in the underserved.
So would you recommend to other entrepreneurs they go about their initial product development this way, or what could they be doing to be thinking about some of these opportunities in just a different way?
I mean, I think the best thing that we did, which was in part circumstances, but a part how we approached it. So we won a pilot health tech grant a year ago and finished a clinical trial with the Montefiore Medical Center.
I want to back up, talk about pilot, because it's a very innovative program New York City's doing. Yeah,
it's a great program. I can't speak highly enough about it. Basically, the city had about $1 million in funding that they kind of broke up into 10 $100,000 grants. And the goal of the program was to basically match large healthcare organizations with early stage technology companies to test a new technology. And it was very much focused on testing something that has not been commercially used yet in a large healthcare organization. And so we were the recipient of that in 2013, and we're working with the Montefiore Medical Center through one of those grants. And one of the greatest things that I think really helped us with that is kind of two things around that. One, when we started working with the Montefiore Medical Center, we had actually just finished building our our MVP, our initial product. So in terms of where we were from a development standpoint, we were very early stage, which made us kind of vulnerable to being able to catch up to all the needs of a large institution, but at the same time made us super agile in evolving our product based on how an actual institution works. And so
I want to actually stop right there, because I think we were talking earlier, Rachel, about the unique opportunities that stakeholders in underserved communities have, whether it's providers or others who can take advantage of what you just described. Not being a large organization, it takes, I think, a very bold stakeholder, a person in an organization, and an organization to embrace a company that's got a minimum viable product and doesn't have a big funded, profitable, large company behind them. And I think some of the things that are coming out today are being started by one or two or three people that get together, entrepreneurs who start a company, and in the early stages, a helping hand and being able to be willing to work with an organization where you were a year ago even took a lot. Can you talk a little bit about the difference that you're seeing in the kinds of organizations and people that are willing to work with someone like Stan and Sense Health, like Montefiore did last year?
Yeah, sure. So, I mean, it sounds like you guys were very lucky with your match with Montefiore. One of the things that I've heard you talk about that I haven't necessarily seen widespread is leadership from the top down at Montefiore. So it sounded like you guys had buy-in from the head of IT, from major departments, really getting behind the idea that they wanted to integrate technology into their work, to the point where they supported purchasing, I believe, smartphones for their staff to be able to use your tool. I think that's key. Having leadership that understands that this can be a way to extend the capacity and the efficiency of the healthcare staff working at any sort of safety net institution.
Are you seeing a shift in the number of organizations out there that are in that position where there's support?
I think slowly. So I think there's an organization out in California called the Center for Care Innovations that does a lot of great work directly with safety net organizations, hospitals, and FQHCs. I think
FQHCs.
I'm sorry, federally qualified healthcare centers.
Okay.
So these are not necessarily hospitals, but more sort of clinic type settings that work with underserved populations. I think So I think Center for Care Innovations is really leading the charge in some ways and pushing technology out there. I think one thing that's really important for entrepreneurs to understand when they think about how to break into this market, if they're looking to break into the delivery system side of things, so really the hospitals and the FQHCs as opposed to working with the plans, is that these systems are incredibly resource strapped. So I think one opportunity, and I think you guys were somewhat able to take advantage of this. I know of other startups that have really taken advantage of this, is that these are systems where if you as an entrepreneur are able to set up a piloting partnership and sort of offer them the product for free initially to show them what the value proposition is, I think that's a great way to get a foot in the door. And
how would you recommend an entrepreneur or startup begin that process? Who would they contact in the organization? How would they even identify these organizations?
That's a great question. I mean, I'll take a stab at it. You might have some thoughts on it. I mean, so an obvious place to start from my perspective is looking at these organizations and seeing if they have care management programs that they're running. One big initiative that is a federal initiative, although not all states have decided to opt into it, is something called the Health Home Initiative, which is a program, basically states are tailoring it, designed on exactly what their needs are. But the point is that it's targeting high needs Medicaid populations. So
can you just talk about a health home? I'm sorry to be
sure. Yeah, no, that's fine.
You're having a lot of I think things I want to unpack and make sure people understand. Talk about a health home.
Yeah. So again, as I mentioned, this is a federally funded initiative. So the feds have agreed to match, I think for 8 quarters, 90% of the cost of the program. States that are interested have applied to it. Not every state in the country has applied to it, but I'll just kind of dive deep into New York's Health Home to give specifics of it. So New York has a very, very ambitious health home up and running. Stan, I think you have done work with them through Montefiore. Montefiore is actually a health home. Their program is designed to integrate physical health and behavioral health needs for high-cost, high-needs Medicaid populations, and really pull in community-based organizations to make sure that they're engaged in the management of this population. Because what we really see is the delivery systems are fairly effective at managing the needs when the patients show up at the hospital or at the clinic, but so much of what affects the overall health outcomes of these populations happens out in the community. And in order to be really effective at proactively managing these patients' care, you really have to be partnering with the community-based organizations. So health homes sort of have that holistic approach there.
Excellent. So when you think about, because I want to step back to what we want to try to make sure that we cover today. If you were to talk about the characteristics of an organization that is leaning in to working with entrepreneurs, what would you say, besides the support from the top down, what else do these organizations need to think about or do in order to begin engaging with the startup community and the entrepreneurs that are innovating in this sector? And then I'm going to flip it back to you, by the way, and you can answer this, but I was going to say, wanted to hear your answer too. So
yeah, I mean, I'll let you start because I think you've learned a lot from your experience piloting with Monty.
I think it's an interesting question. I don't know that there's a great answer to it. We did not have buy-in at all levels when we started. In fact, at the very top levels, we had a lot of skepticism. And that kind of balance of building kind of the internal champion and focusing, where we had a champion within Montefiore was something that kind of organically happened with us, but it did not start at kind of the top level for us. It was
Where did it start?
It was, so there was a researcher who was working with us, who was one of the kind of heads of the program that we were working under within their health home. And that person really kind of became a huge advocate to then kind of start speaking to the person above them and then start speaking with Montefiore at large.
Sounds like traditional sales, right? You got
exactly. And there's nothing kind of unique about that. You need to find a champion. And I think kind of to kind of bring this around with what we were talking about with the product perspective, I think the quickest way that we built a champion, independent of whether this was underserved or not, was getting them to see how quickly we can execute. And I think that, as we were talking about, the kind of the greatest strength you have as an innovator is execution. And all of these groups are very unfamiliar with a technology company coming in and saying, every 6 weeks we launch something new. they don't buy it for a second. They're dealing with epic implementations that are taking 5 years and billions of dollars. And so being able to actually kind of put your product where what you're saying is was really important to us.
So you think one of the biggest advantages was the ability to do not just say speed, but deliver
exactly
and iterate quickly.
Absolutely. And
did that scare them though, or did they love that?
So it was something that I don't know that they bought into when we started working with them.
Once they saw it happening.
Exactly. It gave a lot more confidence to when we said, we did a lot of work. And so, sorry, just to kind of step back, you talk about kind of working with the decision makers or kind of more administrative side versus the users of your technology. And so you obviously have to kind of toe that balance of ensuring that the administrative side understands the value and what you're doing and it's valuable to them. And then the users are actually using it and find it valuable in their day-to-day, which is a whole nother kind of issue given the complexities there. And so we did a lot of work with bringing both groups together. So have the administrative side bring in the actual users and understand both needs. And so as we kind of started with those kind of focus groups, if you want to look at it that way, and then they could see 2 months later a huge product shift, I think that gave the administrative side a lot more confidence to then continue helping us get the feedback we needed to deliver a better product.
So you started delivering data and proof and validation that it was working within a couple of months. So you kind of gave them and built your case for them.
Absolutely.
And so going back to the question of the characteristics, it seems like the willingness by this person to become your internal champion was key. Do you think Montefiore, as an example, had any special characteristics related to being ripe for working with the startup?
Absolutely.
Like
so it comes down to the individual person and the organization. As an organization, Montefiore is known for being incredibly innovative, particularly in population health management. So that was absolutely critical. And there's a number of large institutions, which I wouldn't be the kind of best person to speak to, but I know there are certain academic medical centers that are way more innovative than others. And so I would not approach the less innovative ones. Second thing is, even within an innovative group, there are people who don't buy into kind of the startup mentality, build fast, and you're not going to be able to convert someone who doesn't buy into that. So finding someone where there is that chance and someone who kind of believes in this and has an interest in this is also critical.
How do you think you sniff that out?
Honestly, it's kind of like an evolving process, and I don't know that I have kind of a silver bullet for that.
Just a gut check that you had, in your meetings with them, that they had kind of got it and saw the opportunity to work with you?
Yeah, I mean, from a gut check perspective, to get them to the point of committing to submit a pilot application for the pilot health tech program was kind of, that was a step that someone wouldn't take unless they were willing to
How long did it take to convince them to do that?
That process actually probably took 2 months of just submitting the application. And then there was a whole slew of, which we could get into, legal issues around this population and all of that stuff. But it was not a straightforward path by any means.
So what advice would you have for just to other entrepreneurs that are trying to get their first customers, trying to maybe even get their first pilot, so that they can get that data to validate your product? What advice would you have to your fellow entrepreneurs out there just trying to get started?
Right. So I think you made a really great point. Well, 2 things really. One is the ability to offer something for free. I know that's a contentious issue in the startup space. There's the mantra of if someone's not going to pay for it up front, they're not going to pay for it down the line, and thus you should always get paid for what you're doing. There are then certain approaches to kind of balancing act. I think in this space, new technologies are so new that offering it for free is something that's really important, and even as you're getting paid customers, being able to offer something for free to people moving forward.
And is that as a mechanism to then translate into a real customer? Or?
Absolutely. And so I think that gets at how you offer something for free, right? So going in with kind of unclear metrics as to what this actually costs at the outset.
So you're putting a price on it, but you're just giving you're being very clear of the value of it, even though you're giving it for free.
Even in doing something for free, making it clear that at this time, if we see this, then this is becoming a customer. Because even if someone doesn't commit to that, you start to learn from an organization perspective, even if they don't work with you, what would they need to see at a 6-month point of adopting a new technology to make them reshuffle their budget to pay for it. And so that process at the outset's never fun when you're trying to move really fast and get people using it, but I think is a critical piece, because we've made the mistake of not doing that at the outset with certain groups. And you find that there certainly are organizations that don't have the funds to do it, or really
so
just
even
kind of
being
trying
successful,
something.
you're never going to get money from them.
Exactly.
Even if it's successful. So you're sniffing that out as well.
Right.
And can I just want to add in one point and go back to this like 555 rule that I mentioned. So thinking about a value proposition, this 5% that's responsible for 55% of the costs are hugely expensive. I mean, we're talking 70, 80, 90, hundreds of thousands of dollars a year. And if you have a technology that can reduce one of these patients' inpatient admissions by 1 admission or 2 admissions a year, we're talking $50,000 like that.
Right. So you don't need to make it's not a volume.
There.
Yeah,
I mean,
yeah,
that's
yeah.
that to me is like one of the interesting things about this market is that.
Would you put that up there as among the top reasons why, one of the things and the reasons we were so excited about this grant from Robert Wood Johnson Foundation was because we feel like so many entrepreneurs are ignoring the opportunities in this market. They're going to the typical.
They just don't even know that they're out there.
Yeah. And so they're either going to the traditional academic medical centers or the large hospitals, not in the underserved communities, and they're not thinking about it. So whether it's they're ignoring it or they don't know about it on purpose. What's?
Yeah, I mean, I think there's a lot of challenges for entrepreneurs in this space. I'm not an entrepreneur, but I could imagine, trying to think about if you have a product and obviously you need it to be financially viable. Low-income populations are not one of the first populations that come to mind as like a customer base. But I think it's really, I guess I would emphasize that there's money in this space. There's health plans that are getting money from Medicaid. There's hospitals that are totally looking for ways to manage the costs of these patients. So in some ways, this population I see as the market that the payers have the most to gain by investing in technologies or purchasing technologies that can save them money.
And I mean, one thing that everyone, particularly in New York right now, is talking about is a program called DSRIP, which is the Delivery System Reform Incentive Payment Program.
Wow. Say that 3 times.
Yeah, I know. Let me say it backwards. You can correct me if I'm wrong on the details, but the way that we look at that very simply is New York State focused on redesigning Medicaid. So they had kind of, how are we going to redesign Medicaid? One of the programs that came out with that were health homes. So how can we kind of coordinate care better for these patients in need? Mm-hmm. And as a part of that redesign, New York State saved a fair amount of money, on the order of $8 billion, which they are now reinvesting back into the delivery systems that are supporting the underserved populations. And so what you're seeing now is the state is basically running programs where they're taking applications for how these health providers who are working with underserved are going to build sustainable models to work with those patients long term. And there's that $8 billion being infused right back into those groups to have them invest in trying new technologies and measuring and finding better ways to do that. And so in terms of opportunities today, just a month ago or something, the initial applications for getting some funds to start developing a comprehensive plan were, or those plans were actually awarded. And so now these delivery systems are working on putting a plan together through the fall to how they're going to address this and looking for technologies that are going to do that and how to kind of use human resources. And so, that's like a critical opportunity right now.
So that's a wake-up call to entrepreneurs to think about and the opportunities to go into this market. You mentioned New York, and New York is, for a lot of reasons, a very innovative state when it comes to healthcare and healthcare IT and healthcare services. What other states stick out to you? And maybe you don't, because you spent so much time in New York City, the pilot program and the other things. What states are among the most active in the country in terms of kind of leaning in?
We see Washington State doing a lot of really innovative work in system redesign, healthcare system redesign. There's, I think, 25 states right now who are participating in something called the State Innovation Model, which is another huge federally funded project that's looking to align payment incentives more closely so that folks can coordinate across the Medicaid delivery spectrum. So Washington is the one that's coming to the top of my mind. I don't know if you've worked in other states that you see.
Yeah, well, I guess the thing I'd say is, as we've talked about finding innovative people, innovative institutions, now we're talking about innovative states, which is kind of funny. But New York is really innovative. I think to your point of health homes, right? So we've looked across the country at different states who are implementing health homes.
Yeah.
And New York by far has one of the best infrastructures. And so
Also the most complicated.
Right. But bringing it down to practice from an entrepreneur's perspective, so the state's done this thing through the ACA, there are these health homes, how do we get a hold of them? Well, there's literally a health home white pages that we just went down and contacted every person who had a contact name for them. And so...
That's great. So slow.
Great lesson.
So it's great. So in fact, let's see if we can get that up in the resource center. I think that we have a resource center at startup. startuphealth.com/make an impact.
Yep.
We're bringing together all the resources for entrepreneurs that want to focus on and dig into underserved communities and bring their innovations to underserved communities. So talk about the white pages for health homes.
Well, because New York State is kind of so centralized and has a great resource center themselves, if you go on to whether, I forget, it's NewYorkState.gov or whatnot, and you find kind of the Medicaid area, they have a whole list of the counties and areas implementing health homes and who the point person is for those health homes. And that was a great kind of targeted approach to just start reaching out to people. And when we, kind of talking about the other states, so then looking at other states, so we started looking into some of the other big states for health homes like Maine, North Carolina, Ohio, and you find that the infrastructure at the state level to find contacts is not as good. And given that there's enough going on in New York State, we've really focused here for now. But I think that's an interesting thing to also, in terms of geography, where do you have kind of those types of resources?
So as an entrepreneur, you've clearly made a decision to focus a lot of your early customer development and commercialization on serving underserved communities and focusing on digging up opportunities there. I think a lot of people talk about the Affordable Care Act being a treasure trove of opportunities for entrepreneurs because there's so many different things to kind of solve and get involved with, and there's lots of money flowing into different organizations for different reasons. And if you understand a little bit of the landscape, it's very valuable. How committed are you to using kind of underserved communities as your initial kind of customer focus for the, it's called for the foreseeable future, and how much are you balancing that without the traditional underserved communities?
Yeah, so in terms of outreach and active work that we're doing, it is all focused on underserved right now, and I see that being the case definitely for the next kind of 6 to 8 months in terms of how we're...
They're going to say 6 to 8 years.
6 to 8 decades, actually. And so that's certainly kind of where we focus those efforts. I think one of the interesting things, kind of looking at these models that are emerging, so you mentioned the 50-55 rule, or however you want to kind of break apart the cost. And what was the article? There's an article about the work done in Camden, New Jersey by Jeffrey, was it Hotspotters? Or,
the Hotspotters
right?
article in New York.
And so I think what like has been seen, particularly in underserved communities and then just in general, is that when you have these super high cost people, putting together a care team around them of a number of a social worker or a nurse, whomever, to work with them has been effective at reducing costs and working with those people. And I think that model, just generally speaking, is what's happening in the kind of the health home infrastructure, where let's branch out and focus on, not just the 5%, but let's say the 20-30% of high cost people. But then with that many patients, we can't have this whole care team around them. And so I think that kind of human resources, that model around high needs patients, is something that's very particular to underserved, but we're seeing it everywhere. And so when you look at building a product for the underserved, we also view this as working with commercial populations who have the high needs, high cost patients.
That's an interesting point. What are some of the other myths, I think, of working in underserved markets? You mentioned earlier that there is money in underserved markets for solutions. You just got to think about your solution. What are some of these fallacies or myths that maybe startups or entrepreneurs just aren't aware of because they're thinking about the way they think it is?
So I guess I'll just jump in. So we, with funding from Kaiser Permanente Community Benefit, we're able to run a series of focus groups last spring, I believe, where we interviewed subsets of high-cost populations, high-cost, high-needs populations. And I was so surprised at how agile these folks were with technology. We sort of gave them a questionnaire around, are you familiar with computers? Do you know how to use the internet? Do you know how to use voicemail? do you play video games? And I was just so surprised at, and these were older adults for the most part. I was really surprised at how comfortable they seemed to be using technology. So I think that's one lesson out there for entrepreneurs, is this isn't a population that's just completely living in a bubble and not aware of the technology that's out there. The other thing is that they were really eager. They really saw opportunities for technology to help them. They were coming up with, like, they were like, oh, it'd be awesome if something could help me, like, manage my appointments, and I could have something to store all my records on.
So you basically have a hungry customer, you've got a big need in a big population, and you have a lot of money attached to actually lowering the cost and helping them. So it seems like it's almost the ingredients from an entrepreneur's perspective of a perfect target customer. If you now have, especially the government playing such a big role in helping with reimbursement and other benefits to bring the cost down. But it seems like you've got a lot of really great raw ingredients that a lot of entrepreneurs are missing. Yeah.
Yeah, I think, and it was mentioned before, I just want to reiterate it because it's something that comes up time and time again, that these groups do have access to technologies, and you'll work with a program and come in and say, this is what our technology does, and they'll tell you, no, our patients don't have cell phones, or they don't have text messaging capabilities, and it's actually not true. And you find time and time again that not only do these groups have texting plans, government provided cell phones, all of that, they have smartphones and access to that. And so I think there's the access point, there's the understanding that they know how to use these technologies, and then there is that interest. I think it's kind of this myth that, like, there's just a certain group of people who don't care about their health. Yeah. And I don't think that's actually true. I think there's a certain group of people who can't focus on their health as much as they'd like to, given other circumstances. And I think particularly in this population, there's that kind of idea that it's just someone who's not that motivated to work on their health, and that's false.
Love it. That's great. And what about the myths on the other side for stakeholders in large organizations in underserved communities about working with entrepreneurs? What are some of the myths that we can bust up there? Yeah,
I mean, I don't know if I would call this a myth, but I think there's a huge cultural divide between the startup culture and safety net delivery system. So I think this idea that you guys are so comfortable rapidly iterating and working on the fly and changing things is so different than how healthcare delivery systems typically work. Particularly in like a large scale hospital, these are huge institutions that can't really turn on a dime. So I think one of the things that's been really interesting for me to think about in my past life, what it was like working in a hospital, and how we ran systems there, and now becoming familiar with the startup sort of culture and ideology that you guys work with, is just that I think you really need, in order for it to be a successful partnership between those two bodies, you really need to get to a point where you're sort of speaking the same language and have the same set of expectations about timeline. I think on the startup side, understanding that things might take a little bit longer than you're used to, and it can be really frustrating. But I think there's getting to a common place of understanding about what those two cultures are like is really key.
And what would you point to if you're talking to one of your partners or one of the companies or organizations you work with? What would you say to them to encourage them to take a chance and working with a startup? Yeah,
well, so again, sort of going back to this idea of low cost or no cost pilots, I mean, it's kind of a win-win proposition, right? Like, what do you guys have to lose? If it ends up improving care and helping your workforce and reducing costs and reducing utilization, amazing. You guys have access to a tool. If not, you got the experience of working with a startup company, and hopefully it gave you a sense of the world of possibilities that are out there.
Yeah, I will say, just to play kind of the opposite side that we deal with, is that I do think that kind of thinking is in part what scares a lot of people, is that idea that, like, what do you have to lose? It's free, that type of thing. Because from our perspective, you need the organization to really buy in and spend time trying a new technology. And so there is a cost independent of money around, really trying to push a new technology, and that does take time and resources. And so it's that interesting balance of, on some levels, you're right, like, what do you really have to lose? But at the same time, given they're trying to catch up to where they need to be now, trying some new technology that might get them ahead.
That would be the case at any organization where you're trying a new
Absolutely,
technology.
but I think in this group, or at least kind of what we're seeing is there's so much that's changing right now and so much scrambling that's going on. It's even tougher to get them really comfortable with, hey, we're going to try something new amidst you purchasing a new EMR, you having kind of new payment systems for the patients you're managing, new bill, like all of that.
But I was just going to say, I think that speaks to the point of, as an entrepreneur, really understanding the needs of this population, so that when you're approaching a potential customer, you're providing them with a product that really fits the needs of what their patients are struggling with. You can't really, I would say that a product really has to take into consideration the needs of this population in order for it to be useful. So you can't just say, we've got a diabetes management product, like this would be great for your population. No, if you want this delivery system to pay attention and really think about buying in, you have to understand what the patients are dealing with.
What's your answer to that? I mean, what would you say to the stakeholder at the hospital or the health plan to get them to take a chance in working with a startup?
I mean, I think one thing that's been really important to us is we spend a lot of time on the design of our platform used by the providers. And that's like a tough value from a product perspective, the design of it. But I think when you can come into an organization and talk about these great things it'll do and show them something that visually and intuitively it's very clear how that can accomplish that, and it's not some new system with all of these fields that's going to confuse the users and kind of be tough to work with, I think that actually really helps make them more comfortable with trying something out. I mean, that kind of we're not Apple, but like Apple is all about simplicity and they do a great job with that. And I think in these organizations where you're dealing with a lot of complicated systems, if you can simplify what needs to be a complicated technology on our end, that is worth the time it takes from a design perspective and a product perspective, because it does reduce friction in getting it in the door and getting people to use it.
So is it almost is the question almost, what are you going to do if you don't do this? You try to leverage this technology. It's almost like without a plan and without any engagement in innovative technologies, the organizations have no hope at being anywhere different a year from now or 3 years from now.
So what do you?
I mean,
I don't know if they're thinking that, honestly, because
they're not thinking about their future.
I think that this is a segment of the healthcare delivery system that hasn't quite caught up to the fact that there's so many technologies available that could potentially help them with their efficiency. I think you could make that argument, but I'm not sure they would go there immediately.
Yeah, I mean, I think they're just putting together their basic kind of systems to manage their patients, with the basic requirements, let alone thinking ahead. And understandably, because things have changed for them and they need to kind of update accordingly. So I don't fault them for that. But
so are you both optimistic? How are you guys feeling about the next couple of years in terms of more startups working in underserved populations and communities?
So I'm really excited. I mean, I think you guys are doing great work. The funding that you just got from RWJF, fabulous. I think that really speaks to this growing awareness that there is a real viable intersection between technology and startups and this population. And I really do think that, as time goes along and people like Stan and Sense Health and these other companies really are able to prove an ROI, I think it's just going to gain more and more traction in this space.
Yeah, I mean, obviously we're optimistic about it. We wouldn't be, in this. We think it's a big dead end. No, we're super optimistic. I think kind of from a trends standpoint, one of the things that makes us super excited, and again, as we've talked about, is the access aspect. And I think it's only continuing to grow the access to technologies that all groups are having, their comfort with technologies, and in terms of, whether it's plans around those technologies for data or texting or voice, all of the costs around those are coming down and down and down. And that's critical to be able to have the most channels available to work with patients. And so that's, I think, really exciting, particularly in a group where access has not always been the best.
So as a wrap up, and really appreciate you guys spending the time with us, because I think it's such an important area and we're just getting started. I mean, this is the early days of everything in terms of the reimagination of healthcare, especially in underserved communities. What do you wish you knew when you started Sense Health, and whether it's something you wish you had known that you did differently or something that you would have liked to go back and tell your, prior self when you were getting started?
I mean, I guess the biggest thing that is we're still figuring out is on the policy side. I think it's so complicated, the dynamics of where money is coming in, the different people who are touching that money, who's responsible for patients, and really, I mean, healthcare is complicated in general with who's paying and who's receiving services and who's providing services.
And who's approving the paying.
Exactly. and I think in this space, it's even worse. And I actually remember from our work with Montefiore, with the head of the program we were working with, I was continuing to ask him kind of a ton of questions trying to figure things out. And one email is just like, sorry to be a pain, like I'm slow to pick up on this stuff. And he's like, I don't understand it. The people that are like behind this are still trying to figure that stuff out.
We're actually going to do a future episode just on policy in underserved markets, and that'll be one of the future episodes. Steve mentioned this earlier, putting all these resources up at startuphealth.com. Where can people learn more about both of your organizations?
I mean,
you're at sensehealth.com.
Sensehealth.com is where you can find out all about us. And then, yeah.
Yeah, and we're at www.chcs.org. And we've got a resource center actually of our own up there. And we put out a fair amount of issue briefs and information out there. Where I think we've got potentially some really good information up there for folks who are just trying to get a read on the policy aspect of things, who this population is. So I encourage folks to check out our website.
Fantastic. So we've got links to both of those resources on the startuphealth.com/make-an-impact, which is the resource center that we've built with the grant from Robert Wood Johnson Foundation. And we're going to continue plugging away at really shining the spotlight on underserved communities from both an entrepreneur's perspective, so they can understand what you described today is such a wonderful opportunity to make a difference and make an impact, and also for the stakeholders that really are trying to understand which startups and which innovators and what it means to really embrace early stage innovation. So I want to really thank you both for spending so much time with us today,
thank you so much.
Opening up people's eyes and being such a wonderful resource, not only to other entrepreneurs and to organizations around the country about tapping into this area. I think it's going to, be really impactful when we look back a decade from now and look at how much is different and how much has changed over the past decade. So, thank you for joining us. Thank you for joining us for another episode of Startup Health Now. Please join us not only on startuphealth.com/make-an-impact, but also on future episodes of Startup Health Now, where we're celebrating the healthcare transformers and the change makers that are reimagining healthcare.
Thank you.